Hey class, can you see class? This pain. Can you see class?
Yes, sir.
Right now, listen carefully, right? Whatever muscle which is responsible for the hip abduction, right? So this muscle basically sitting, usually we can say lateral to the hip joint. Okay? Sitting lateral to the hip joint. Okay? So which is when we talk about hip abductor, right? So this muscle, this is the arrangement for the hip abductor. This muscle basically cross your hip joints laterally, right? So we know whatever muscle which is have this kind of pattern, right? Which is it extend your hip joints laterally from your pelvic towards your femur, right? So we know this muscle basically responsible for hip abduction. The first muscle that you should know is
Sir,
yes,
saya tak masuk lagi yang extension tu.
extensor.
Ha.
Oh really? Oh
Hari
yeah.
tu, ha,
Okay, no.
hari
I finish. Hip flexor finish right? Hip flexor.
tu dah habis dah.
Okay, very good, right? Now we go into the, don't worry, after hip abductor, I go to the hip extensor, right? Don't worry.
Kita,
Okay, all right, okay. Now we touch about hip abductor first because hip abductor, we only have basically three muscles only. And I think it's very, very easy to understand. Right, for hip abductor, the first muscle that you should know is this muscle known as gluteus medius, right? Gluteus medius. This is the biggest muscle responsible for hip abductions. Number two, we have deep into the gluteus medius, we have gluteus minimus. And the last one, the smallest, will be your, we call as a tensor fascia lata. Tensor fascia lata. So please remember, right? Gluteus medius, gluteus minimus, and also tensor fascia lata. And all these muscles basically cross your hip joints laterally, right? When these muscles cross your hip joints laterally, right? So when this muscle contract, it contracts towards your origin. That's why you can bring your femur towards the origin so that you can produce hip abductions, right? Right now, okay, please observe this atlas, right? This 3D atlas, right? Now, this muscle, as I explained to you before, right? It cross your hip joints laterally, right? And also, you need to remember that this muscle is almost similar to your deltoid, right? When we talk about your shoulder, right? Your shoulder or your pelvic, your pectoral girdles, right? This muscle basically similar to your deltoid because your delta also cross your shoulder joints laterally, right? That's why your delta basically is very, very important, responsible for the shoulder abduction. Now, these three muscles cross your hip joints laterally, right? So, at which area you can see this muscle plus? This muscle actually. This is the gluteus maximus posteriorly. Now, right? So this muscle actually, right? So this group of muscles laterally over here. So all these muscles basically known as a hip abductor as a group, right? We call it as adductor group actually, right? So this abductor group consists of three muscles, right? The first muscle that you should know, okay? I hide everything first, right? Okay. Okay, this muscle, you should know about this muscle first, right? So this muscle basically known as a gluteus medius. Okay, this muscle basically known as a gluteus medius, right? And this gluteus medius basically originate from where? Gluteus surface of the ilium. Okay, it originates from the gluteus surface of the ilium. Most specifically is this muscle basically originate in between posterior gluteal line and also anterior gluteal line. All right. Okay, maybe I can draw for you something over here. Can you remember class your gluteal surface? Your gluteal surface of the ilium? This is iliac crest, right? ASIS, AIIS, right? And this is the PSIS, PIIS, right? And absolutely this is your greater sciatic notch, right? Okay. And centrally on the lateral surface, we can see your acetabulum, right? I think this is very simple diagram. Anterior and this is posterior. And this is your greater sciatic notch. Absolutely, this is your PSIS. This is PIIS. Anteriorly, you have ASIS and also AIIS, right? Anterior inferior iliac spine, right? And above, you have iliac crest, right? So I think I already explained to you that This is referred to the gluteal surface. So this surface basically, the whole thing we call as a gluteal surface. And this gluteal surface basically you have three conspicuous marks, okay, very prominent marking. Right? And these prominent marks basically extend from where? Number one, it extends from the greatest shining notch, and this line basically moving upward, right, towards the iliac crest. That's number one. Number two, again from greater shining notch, you can see this line basically moving anteriorly towards iliac crest, right? And number three is from this greater shining notch, this line basically travel anteriorly, right, in transverse axis, right? So meaning that you have three line over here, which is this is what we call as a gluteal line. Okay, the most posterior. This is the first one. The first one. Sorry, the first line over here, the second line over here, and the third line over here. And the first line will be this what we call as a posterior gluteal line. Right? I think I explained to you before, right? When we talk about the structures of the ilium. Number two, we have anterior gluteal line, right? And the last one, the most inferior, this is what we call as a inferior gluteal line class. Okay, inferior gluteal line. Why we need to know about this line? That's basically because of this line indicate there is something attached in between these two lines actually. Right? For example, the first one that you should know is right one muscle attached in between these two lines. Okay, in between these two lines, there's one muscle attached. This muscle attached into this region, right? And this muscle, which is attached in between posterior gluteal line and also anterior gluteal line, and this muscle will be your gluteus medius. Understood? Okay. So now when we talk about what is the origin for the gluteus medius basically originate dekat mana? Gluteus surface of the ilium. Tetapi more specific dekat which region? In between posterior gluteal line and also anterior gluteal line. Over here you can see your gluteus medius. Just posterior to this is a posterior gluteal line, right? Just posterior, okay, posterior to the posterior gluteal line. This is another muscle actually attached into gluteus surface, but now posterior to the posterior gluteal line. And this muscle basically known as a, it's not abductor muscle, but you should remember because this muscle basically belongs to extensor muscle actually, and this muscle known as a gluteus maximus. Okay, gluteus maximus. Right. And the last one is right deep into the gluteus medius. Deep into the gluteus medius, right? You have another one muscle which is attached in between anterior gluteal line and also inferior gluteal line. And this muscle is sitting in between these two lines. Okay. This muscle is sitting in between these two lines. All right. So you can imagine superficial, you have this muscle which is known as the gluteus medius, big and superficial, right? And deep into the gluteus medius, right, you have one small muscle which is originate from the gluteus surface, but more specific in between anterior gluteal line and also inferior gluteal line, and this muscle known as gluteus minimus. Okay, so this is the origin for each muscle actually, origin for each muscle for the abductor. Right. Now back to this atlas actually. All right. Now, okay. Now you can imagine actually class, right? Now you can imagine, right? If I hide this muscle class actually, right? Okay. Now you can imagine. So this is iliac crest actually, right? Posteriorly, you have posterior superior iliac spine. This is your posterior inferior iliac spine, and this is your greater sciatic notch, right? And from greater sciatic notch, you can imagine one line over here, class. Extend upward, all right? Extend upward. So what you can see here, all right? This is what we call as a posterior gluteal line. Okay, this is what we call as a posterior gluteal line, right? Again, from greater sciatic notch, one line travel diagonally, right? It travel antero-superiorly towards iliac crest. So this line known as the anterior gluteal line. Okay, so this is the anterior gluteal line. And the last one, this line, okay, travel anteriorly, okay, travel anteriorly, all right, okay, in transverse axis. Okay, so this line we call as inferior gluteal line, right? So this is posterior gluteal line, This is anterior gluteal line, and this is inferior gluteal line, right? So back to your muscle class. So which means here class, this muscle we call as a gluteus minimus, right? So this is gluteus minimus. So please remember, gluteus minimus originate in between anterior gluteal line and also inferior gluteal line. In between anterior and also inferior gluteal line, right? So this is your gluteus minimus, okay? And also when we talk about the superficial muscle, okay, which is this your gluteus medius. Please remember, gluteus medius attached in between your yes class attached in between your yes attached in between your post sorry okay, in between your posterior gluteal line and also anterior gluteal line. So these are the region where you can see your gluteus medius, right? And posterior to the this is posterior gluteal line, right? So posterior to the posterior gluteal line. Now you can see gluteus maximus, the most superficial muscle. Okay, the most superficial muscle will be your gluteus maximus, but gluteus maximus basically we define as a this is hip extensor, right? Okay, but the attachment side, the origin for this muscle basically almost the same. It attached into the gluteus surface, but it attached posterior to posterior gluteal line, right? Now we talk about the gluteus medius and also minimus, and where's the exactly insertion class? Okay, where's the exactly insertion? Right now you can see clearly class over here class, right? So this is your gluteus medius and this is your gluteus minimus, right? And absolutely this muscle actually attached into this projection, very big projection of here class, right? And this projection we call as a yes class. This projection we call as a this is head, this is neck, and this is the quadrilateral projection on the lateral surface, proximal ends of the femur. And this projection we call as a yes class. Yes class. Yes.
Greater trochanter betul?
Very good. Greater trochanter. Okay, greater trochanter. Meaning that your gluteus minimus attached into greater trochanter, gluteus medius also attached into greater trochanter. Okay, clear class? Now you know origin and also insertion for two muscles, right? You know gluteus medius and also gluteus minimus, right? Both of these muscles attach into greater trochanter. Okay, greater trochanter. Right, next. The third muscles, right? The third muscle actually known as a TFL. We call it as a tensor fascia lata. Okay, tensor fascia lata. This is tensor fascia lata actually. Okay, this is tensor fascia lata. Tensor fascia lata, what we call as a tensor fascia lata. Tensor means tensions. This because this muscle create tensions, actually create tensions, right? But the thing is, what's fascia lata? Fascia lata actually refer to the connective tissue which is cover your thigh muscles. Okay, cover your thigh muscle. We call it as a fascia lata. Okay, maybe I can draw you something simple diagram. Listen carefully, class. All right, all right. Let's expose that this is your thigh. All right, this is your thigh, your knee, this is your leg. Right, all right. Okay, so this is the medial and this is lateral. Right, this is your thigh actually. Right, okay. This thigh, basically, if I cut your thigh here, right, transverse section of the thigh, right? So now we observe this area, your thigh, superiorly. Okay, superiorly. So what you can see here, class, absolutely centrally, not centrally actually, right? But by the way, this is femur actually, right? So this is femur, right? Okay, you have femur inside, right? And this femur basically enveloped by muscles, enveloped by muscle. Okay, so posteriorly you have extensor muscles, medially you have abductor muscle, and anteriorly you have flexor muscles. Okay, this is medial, this is lateral, this is anterior, this is posterior, this is your femur. So meaning that this is your flexor group, this is your abductor group, and posteriorly you have extensor group. Okay, now listen carefully, class. Within your thigh, actually, your muscle is basically arranged by compartment and compartment. right? Arranged by compartment and compartment, right? Within your thigh, right? Your thigh basically is separate by compartments. You have flexor compartment anteriorly, you have abductor compartment medially, and also, sorry, not abductor, sorry class, not abductor, but adductor, sorry, adductor, okay? ADD, adductor, not abductor. We don't have abductor, but we have adductor, okay? We have adductor compartment, and so the most posterior we have extensor compartment. And all this compartment, right? Why we have compartment? Because all this compartment basically it's separate by connective tissue. It's separate by connective tissue. It's separate by connective tissue, which is this connective tissue arrange all this muscle into compartment. And all this connective tissue plus that you can see here, all this connective tissue which is arranged, which is divide your muscle into compartment, we call as a fascia lata, right? So please remember, fascia lata basically refer to the connective tissue is a membrane, which is your it divide your thigh muscle into compartment. How many compartment you have? Three compartments: anteriorly flexor, medially adductor, and also posteriorly extensor. The thing is, class, right? When we talk about fascia lata, right, on the lateral surface of the thigh, on the lateral surface of the thigh, okay, basically, all everything covered by fascia lata, right? Everything covered by fascia lata, right? But at the lateral surface of the thigh, basically, this fascia lata become thickened. Okay, it become thickens on the lateral surface of the thigh. Okay, I repeat, class, right? Fascia lata basically cover your muscle into compartment. That's number one. Number two, on the lateral surface of the thigh, this fascia lata become thickened. Right, it become thickened on the lateral surface of the thigh, and this thickenings of the fascia lata. Okay, so this thickening, penebalan, thickenings of the fascia lata, this is what we call as a, this you need to remember this structure, we call as a iliotibial band, or some books says iliotibial tract, right? ITT or ITB, right? Iliotibial band or iliotibial tract class, right? Okay, so again, how you define iliotibial band? Iliotibial band basically refer to the thickening of the fascia lata. Okay, thickening of the fascia lata. Okay, let me draw you something from the lateral view of your pelvic as well your femur until your tibia actually, because this ITB basically is situated on the lateral aspect your pelvic, lateral aspect your thigh, and also until your knee joint actually. Right? Again, this is your iliac crest, right? So let's expose this iliac crest, ASIS, AIIS, simple diagram. This is PSIS and PIIS, and this is your greatest sciatic notch, right? Okay, and over you can see your superior ramus of fibula, inferior of fibula, and so on, right? Okay, all right. Now, what we concern is this structure, right? Which is this we call as acetabulum, am I right? This is acetabulum. This is anterior. This is posterior. This is your acetabulum, right? And the structure which is sitting inside your acetabulum, absolutely right. You know, right? Absolutely, this is your, yes, class. Absolutely, this is your femur, right? This is your femur. Okay, specifically, this is your head. This is your head of femur. This is your head femur, right? So over here, this is your greater trochanter, and this is shaft of the femur, right? Shaft of the femur. All right. Okay, class. Okay. Okay. And this is your femur class laterally, right? This is lateral view, right? All right. And absolutely, this is your tibia, all right? This is your tibia. Anteriorly over here, this is your patella class, right? Okay. Absolutely, laterally, you can see this is your fibula, right? Sitting lateral to fibula to the tibia. All right. Now, basically from this view, right, clearly you can see that, okay, this is only schematic diagram, but at least you can visualize this ITB actually, right? So this ITB actually extends from the iliac crest over here. It crosses your iliac crest, this ITB, thickening of the fascia lata, cross your hip joint, right, laterally, your femur class, your femur, until reach your lateral condyle of the tibia. Okay, attach into the lateral condyle of the tibia. Over here class, okay, this structure class. So meaning that all this structure, which is extend from your iliac crest, your ilium, right, your femur laterally until your tibia, your lateral condyle of the tibia. This is what we call as a iliotibial band. Okay, so this is your ITB actually. ITB, iliotibial band. Understood, class? So again, what is ITB? Thickenings of the fascia lata, which is extend from the iliac crest until lateral condyle of the tibia. That's what we call as iliotibial. Ilio meaning ilia, tibial refer to the tibia, right? Your lateral condyle of the tibia. Then refer to this thickening, right? Thickening of the fascia lata. So this is your ITB, right? Okay. Do you understand, class, so far? Clear, class? Hello? Clear, class?
Clear, sir.
Clear. Okay, now why I need to discuss about ITB, class? Because of one of the muscle attached into ITB, basically that muscle known as a tensor fascia lata. That muscle known as a tensor fascia lata. Tensor fascia lata, this is your iliac crest, right? This is your ASIS. I think you can label everything, actually. This is your iliac crest. This is ASIS, right? This is AIIS. Posteriorly PSIS, and this is your PIIS, right? So this muscle actually, right, coming from where? Anterior regions of iliac crest. Anterior regions of the iliac crest. Lateral, on lateral lip. And this muscle attached into your ITB. This muscle coming from the anterior part, iliac crest, and insert into your ITB. And these muscles, that's what we call as a tensor fascia lata. Okay, tensor fascia lata class, right? Now back to your 3D image class, right? So again, see, this diagram is very, very clear. So laterally, what you can see here, class, can you see this thick, this band actually, this whitish band actually? This band, basically, this structure refer to ITB, iliotibial band. Okay, so this is ITB. Okay, and what you can see here, this is your TFL, this is your tensor fascia lata. And this tensor fascia lata coming from where? Iliac crest. Which part of iliac crest? Anterior part of iliac crest, not the whole iliac crest. Not the whole iliac crest, but somehow it attached into anterior part because this is your iliac crest. The whole thing is iliac crest, right? But the thing is, this must only originate from anterior part of the iliac crest. Okay, and this muscle moving downward, all right, and posteriorly and attached into your, this is your ITB class. Okay, this is your ITB. See, this ITB extend downward until attached into your lateral condyle of the tibia. So this ITB, it become attachment site for the tensor fascia lata class. Understood, class so far? Now I think clear, right? Three muscles for the hip abductor. Understood, class? Origin and incision.
Yes.
Clear, class, right? I think you can remember directly, I think. All right? Okay? Okay, when you have viewed this diagram, this atlas, I think clearly you can see everything. Right? But the thing is, right, class, now if I asking you, class, right, please give two muscles which is insert into ITB. Two muscles which is insert into ITB. The first one will be your,
Gluteus Maximus.
the first one that we discuss. Okay,
Extensor.
tensor fascia lata. Very good. Tensor fascia lata. That the first muscle that you should describe, which is muscle which is insert into fascia lata or muscle insert into ITB, iliotibial band. This is the first one. The second one is absolutely right that you okay muscle which is that you mentioned earlier, right? This muscle will be your gluteus maximus. Your gluteus maximus also having incision dekat mana? Dekat ITB also, iliotibial band. Okay, meaning that this ITB become attachment site. What is the function for ITB? One of the function for the ITB is it become attachment site for two muscles. Number one, attachment site for your tensor fascia lata. Number two, attachment site for the gluteus maximus class. Right? Clear class of one? Whereas the gluteus medius and also gluteus minimus, these two muscles insert into which area? Insert into your greater trochanter. Okay, not insert into your ITB, but somehow it attached into the bony structures, right? But TFL, yes, it totally attached into the ITB. But the thing is, the gluteus maximus, this gluteus maximus basically has a two incisions. Number one, it attached into the ITB, iliotibial band. Number two, it attached into your femur by attached into the gluteal tuberosity. Right. Okay, I think finish regarding your abductor class. Do you have any question, Christopher? Abductor. So abductor muscle only three. The most important things that you should know. Medius, minimus, and TFL, tensor fascia lata. So do you have any questions so far, class? Clear, class?
Clear.
Okay, very good. Now we go into hip extensor. Okay, now we go into hip extensor. All right, hip extensor. Again, when you want to understand how this muscle can produce hip extension, if we describe about hip abductor, all right, regarding the line of pull for this muscle, right, we know that this muscle basically is sitting on the lateral aspects of the hip joint. So when we talk about hip extensor, this muscle, right now, I draw your your hip joint again. I think very simple diagram, class. All right. So you should remember this is your acetabulum, right? So this is your head of femur, all right? So greater trochanter, femur, all right? And this is your lesser trochanter, right? Okay, now listen carefully, class. In order to produce hip extension, class, this muscle must cross your hip joint. Yes, class, this muscle mesti akan cross your hip joint. Yes, apa yang faham ni, class? Secara posterior, understood? If hip abductor cross your hip joints laterally, all right, this way it cross, your hip extensor must cross your hip joint posteriorly. Posteriorly, class. Okay, this is laterally. If these muscles cross your hip joint anteriorly, if this muscle cross your hip joint anteriorly, anteriorly, meaning that this muscle responsible untuk apa? Untuk melakukan pergerakan flexion. Understood, class? If these muscles cross your hip joint posteriorly, ini adalah di bahagian posterior, right? So meaning that these muscles akan melakukan which movement? Akan melakukan pergerakan, yes, extension, class. Okay, extension. All right. And if this muscle cross your hip joints laterally, absolutely this muscle can produce, yes, class, your gerakan apa? Yang kita bincang tadi, your abductions. Right? So now kita fokus pada extensions, class, right? Kan? This muscle mesti cross your hip joints posteriorly in vertical directions or in vertical axis, right? So which is the first muscle that you should know regarding the hip extensor adalah the first one, absolutely your gluteus maximus, class. Okay, gluteus maximus. Number two, yes, you have accessory muscle, which is synergist muscle. This is prime mover actually. The second one, we have synergist muscle or assistant muscle, which is known as a hamstring. And as you know, hamstring consists of several fibers, right? The first one we call as a biceps femoris. Number two, medially we have semimembranosus. And the last one, we have semitendinosus. And please you need to remember why we call it as a biceps class femoris, because it has long head and also short head. Right, okay? So this is become prime mover muscle, right? This is primary muscle. And this hamstring becomes secondary muscle or synergist muscle. Right. Now, clear class? Now we have gluteus maximus and so we have hamstring. Right, next. Okay, class. Do you have any questions so far, class? Clear class so far?
Clear.
Okay, now, now we talk about gluteus maximus, the biggest gluteus muscle actually, right? The thicker, right, big, right, and it's very broad muscle, right? And this muscle we call as a gluteus maximus. Gluteus maximus actually is very, very superficial muscles, right? And this muscle basically originates from several places actually, right? So this gluteus maximus basically originate from where? And the first one that you should know is this muscles. Okay, I isolate this muscle first. All right, this is your gluteus maximus. Your gluteus maximus actually originate from where? The first one, it originate from here, your gluteus surface of the ilium. Specifically, dekat mana? Posterior to posterior gluteal line, right? Okay, so this is gluteus maximus. It attach posterior to posterior gluteal line. That's the first one. The second one is right. One another fiber selain attach pada bahagian gluteus surface of the ilium, it also attach dekat bahagian mana? Dekat bahagian your sacrum. Okay, posterior to the sacrum, right? Or somehow we can say it attached into the sacral crest, or more specifically, yes, specifically, the okay, this is your sacrum actually, class. This is your sacrum, right? See, the lateral, this is the posterior surface of the sacrum, right? The lateral margins of the sacrum posteriorly, this is what we call as lateral sacral crest. Okay, lateral sacral crest over here, right? Okay. Now, by the way, right, you should remember sacral crest because sacral crest have it has two structure actually. It has lateral and also it has medial sacral crest. Now, by the way, your gluteus maximus basically originate from where? It originates from the lateral sacral crest, or you can call it as a sacral crest only. Okay, okay. So it attach into the mana class? Attach dekat you punya sacral crest. Okay, so I repeat, the first attachment attached into the ilium, which is posterior to the posterior gluteal line. Number two, it attached into your sacral crest, or specifically lateral sacral crest. Okay, so it has two origin. One originate from the ilium, one originate from the sacrum. And this gluteus maximus, see, it has very, very big muscle actually. So this muscle again has a multiple incision. The first incision class will be your it attached into your ITB, iliotibial band. Okay, iliotibial band, right? And also this muscle, which is your gluteus maximus, not only attached into your ITB, right? It also attached into yes class. See, it also attached into this is the posterior surface. Okay, over here. Okay, okay, so this is the posterior of the femur, right, class? Posterior of the femur, right? Can you remember, class, the structures of the femur, class? Right? Posteriorly, okay, let me draw you something, class. Okay, posterior view, proximal ends of the femur. Okay, again, you have spherical in shape. This is your hip of femur. Absolutely, this is your neck of femur. Clearly, laterally, quadrilateral projection. This is what we call as a greater trochanter. And posteromedially, you have lesser trochanter, right? And this is your shaft of the femur, right? This is your shaft of the femur moving downward, right? So this is the posterior view, right? So in between greater trochanter and also lesser trochanter class, you have this structure class. You have ridge over here, and this structure known as a S class. Yes, in between greater trochanter and also lesser trochanter, posteriorly. Yes, class, this structure known as a
Intertrochanteric line.
posteriorly. Posteriorly.
Intertrochanteric crest.
Very good. Intertrochanteric crest. Line basically anterior. Posterior we have crest. All right. So now this intertrochanteric crest just below to the intertrochanteric crest. Basically, you have two structure, very prominent structure. Basically, because why? Because it become attachment site for muscle. Number one sitting laterally. This region, one sitting laterally. Right. This is just okay. We we review your structures of the femur, right? Okay, so that you should understand, because of this region is very important, because there are so many muscles attached, okay, in this area actually. So now just below to the intertrochanteric crest, you have one roughened surface over here sitting laterally, and this roughened surface we call as a, yes class,
Gluteal tuberosity.
very good, gluteal tuberosity. Okay, this is gluteal tuberosity, right? And medially, there's one line extend from the lesser trochanter, and this line moving downward. Can you name this line, Blas? Medially. Okay. This line we call as a, yes, class? Yes, spiral line, or specifically we call as a pectineal line. Okay. Pectineal line. This gluteal tuberosity, right, extend downward toward shaft of the femur, and also this pectineal also extend downward as a shaft of the femur, all right, which is it will develop, we can say is a vertical ridge, right, at the posterior shaft of the femur, and this structure we call as a, yes class, this structure we call as a posterior shaft of the femur, we call as a, yes, very good. This structure, the transverse, so not transverse, the vertical ridge, right, we call as a linea aspera. All right. Now focus on the gluteal tuberosity over here. All right. So back to this diagram. All right. This atlas. All right. So meaning that now you can imagine class, right? So this is the greater trochanter, and in between over here, this is intertrochanteric crest, and this is the lesser trochanter, right? So you can imagine over here, this region we call as a gluteal tuberosity. Now you need to imagine, right? This region we call as a gluteal tuberosity extend downward as a linea aspera. So from the lesser trochanter moving downward, you can imagine over here, this is what we call as, see, you can see this line. This is what we call as a pectineal line. Okay, medially we have pectineal line, laterally we have gluteal tuberosity. Both of these structure moving downward and form your linea aspera of the femur, right? So now back to your gluteus maximus class. All right, can you see class? So this gluteus maximus attached closely to the gluteal tuberosity. Okay, so it attached closely to the gluteal tuberosity class. Okay, so clear class, origin and also incision for the gluteal tuberosity. Okay, number one, attach into the ITB. Number two, attach into the gluteal tuberosity. Okay, in terms of in origin, number one, attach into the ilium by attach into the posterior gluteal line. That's number one. Number two, it also attach into your lateral sacral crest. Lateral sacral crest, right? Okay, and the posterior surface of the sacrum, right? So this is the origin and also incision for the gluteus maximus. Sola second class. Clear class? Clear?
Clear.
Very good. Now we go to the accessory muscle class. Accessory muscle, which is helping gluteus maximus to perform hip extension. Right now we talk about the posterior compartment of the thigh. Right, posterior compartment of the thigh. Okay, because I already explained to you that your thigh basically divide by fascia lata into three compartments. Right, divide. Okay, okay, it divide by fascia lata into three compartments. The most anterior compartment over here, this is your flexor muscle, right? And here, this is the middle compartment. All this muscle we call as adductor group, adductor compartment. Whereas posteriorly, you have this compartment, right? And this compartment, every muscle which is belong to the posterior compartment, all this muscle collectively we call as a hamstring, right? So now when we talk about muscle which is assist in terms of hip extensions, right? We should explain about your hamstring. Okay, we should explain about hamstring, right? So this is a hamstring actually, all right. Hamstring basically consists of three fiber. Okay, that's how some books says. It has we call it as a lateral hamstring, and also we call it as a middle hamstring. Okay, one fiber on the lateral side and two fiber on the middle side. Okay, but collectively everything we call as a hamstring. Now we talk about the first muscle of the hamstring, which is known as a bicep femoris. This is the bicep femoris. Okay, which is sitting laterally. Okay, everything basically belong to posterior compartment, but this muscle more lateral side. So this muscle known as a bicep femoris. Okay, now kita isolate this muscle. Okay, this is your bicep femoris. Why we call it as a bicep femoris? Because this muscle consists of two head. Okay, it consists of two head. It consists long head and also short head. Long head basically originate from where? This muscle originate from this region, which is this region we call as a, yes class? Absolutely, this is your ischium, right? Thick, roughened surface of the ischium. And this part, very good, ischial porosity. So meaning that when we talk about the long head of bicep femoris, it's originate from the ischial tuberosity. Okay. Whereas when we rotate this femur, right? Okay, when we rotate this femur, right? What you can see here, class. Can you see, class? This muscle has another fiber over here. But somehow this muscle is not originate from the pelvic, sorry, from the ischium, but somehow this muscle originate from where? From your femur. Specifically, originate from your linea aspera. This muscle we call as a short head of bicep femoris. This is long head, this is short head. Okay, both adalah bicep femoris, but long head and short head. Long head is ischial tuberosity, whereas the short head linea aspera. And then toward distal, okay, towards your knee joint, right? So what you can see here, the short head and also the long head basically join together to form one muscles, which we call as a bicep femoris. And this muscle cross your knee joint posteriorly, and moving laterally and attach into your, yeah class, which bone ini class?
Fibula.
Very good. Specific, this is head of fibula. Head of fibula. Understood? Head of fibula. Please, you need to remember because bicep femoris sitting laterally, okay, and attached into your tibia or fibula. Because of, as you know, your fibula basically, this is lateral bones, am I right? So meaning that your bicep femoris basically insert into lateral bone, which is your fibula. Specific head of fibula. Right. That's number one. Number two is we have middle hamstring. Middle hamstring means hamstring basically sitting on the middle surface, right? On the middle side. So we have two hamstring muscles on the middle side. Right. Number one over here, okay, superficial, which is the superficial muscles, which is we call as a semitendinosus, right? Why we call it as a tendinosus? Because of the shape dia kelas, right? Apa shape dia? Shape dia bentuk tendon, am I right? Okay, it's a rounded, right? It's a cylindrically in shape, right? Similar to the tendon punya shape actually. That's why we call as a semitendinosus, right? Just deep into the semitendinosus, right? We have another muscle. Can you see this muscle? Okay, it's flat, right? Almost flat and wide. Okay, the lebar actually, the flat and lebar. Okay, and this muscle we call as a semi-membranosus. That's what we call as a membranosus because the shape adalah almost macam bentuk membrane. But this muscle basically sitting deep, whereas superficial we have semi-tendinosus, right? But I think easy to remember in terms of origin where the semi-tendinosus and also semi-membranosus Both of these muscles basically originate from where class? See, it originates straight away attached into your origin from where? Ischial tuberosity. So when we talk about hamstring muscle, 3 out of 4 hamstring fiber basically originate from ischial tuberosity, which is the first one, long head of basset femorus. Number 2, semi-tendinosus. Number 3, your semi-membranosus. Everything originate from ischial tuberosity except your short head of basset femoris, which is originated from where? Linea aspera. Right. Next. So now up to this muscle class. Do you have any questions? Clear class? Clear class? Anything?
Clear.
Okay, very good. now, now we talk about semi-membranosus first. Okay, this is the semi-membranosus class. Okay, see? I think based on this diagram, I think very, very clear. So this semi-membranosus originates from where? Again, ischial tuberosity, which is upper border, ischial tuberosity. Now, by the way, this is ischial tuberosity. And the shape almost membrane in terms of shape. And these muscles sitting laterally, medially, right, medially, and attached into which structure class? Absolutely your tibia. But which part of the tibia class? Again, I already explained to you that tibia basically almost similar to your femur, right? It has medial condyle and it has lateral condyle. Because this is the medial condyle of the femur, this is lateral condyle of the femur, meaning that this is medial condyle of the tibia and this is the lateral condyle of the tibia. Meaning that this semi-membranosus basically attached dekat mana? Dia attached pada medial condyle of the tibia. Understood? Medial condyle of the tibia. Kalau saya tanya dekat you sekarang ni, anterior or posterior surface of the medial condyle dia attached? Anterior surface or posterior surface of the medial condyle? Yes, class?
Anterior.
Are you sure this is anterior? This is anterior, am I right? Because you have patella over here, right? This is anterior view, am I right? This is posterior view, right? Yes, this is posterior view. So meaning that the semi-membranosus attached dekat bahagian mana? Anterior ke posterior you punya medial condyle? Yes, class.
Posterior.
Absolutely, class. This is posterior surface medial condyle of the tibia. Understood? Posterior surface medial condyle of the tibia. You need to be quite careful, class, because the last exam, especially in MCQ, right? Maybe they can ask you, right? This statement explain about the hamstring fiber, right? Okay, maybe the first statement A, right? They explain about semi-membranosus basically insert into the anterior surface of the tibial condyle, tibial medial condyle. Right. That's why you should precise you punya jawapan you. You kena precise dengan you punya jawapan you, whether anterior ke posterior surface. Right? Because of, you should remember, semi-membranosus and also basset femoris, these two muscles attached dekat bahagian posterior. Semi-membranosus attached dekat bahagian posterior surface medial condyle of the tibia. Whereas the basset femoris attached dekat bahagian mana? Posterior surface head of fibula. Both of these muscles attached dekat bahagian posterior surface. Right? Except semi-tendinosus, they attached di bahagian anterior. Right? Saya ulang semula kelas, semi-membranosus basically insert into the posterior surface medial condyle of the tibia. Right? Posterior surface medial condyle of the tibia. So this is your semi-membranosus, right? So now when we talk about the superficial muscle, right, class? Superficial muscle, which is absolutely now we have your, this is semi-tendinosus. Superficial to the semi-membranosus. Origin, same thing. Ischial tuberosity. The difference is semi-membranosus, the origin is basically an upper border, okay, upper region, whereas the semi-tendinosus basically sitting in the lower region or lower part of the ischial tuberosity. Okay, it's very thick muscles, almost cylindrical in shape. That's why we call it as a semi-tendinosus. and this muscle basically sitting medially. This is somehow we call as a middle hamstring, and this muscle class, right? So these are the tendons of the semitendinosus, right? It cross your knee joint medially. Somehow this tendon from posterior, can you see class? See? From posterior, this tendon cross your knee joint posteriorly. Suddenly, this tendon moving anteriorly and attached into the anterior surface of the tibia. That's right. You should remember about this incision class because this incision basically similar to the incision for the sartorius. Can you remember class your sartorius? Your sartorius basically originate from your ASIS. This muscle very long S-shaped muscle basically, and this muscle insert into this region. Okay, into this region. Right, so it's not exactly your middle condyle actually. Okay, usually we describe as this refer to the inferior surface medial condyle of the tibia. Inferior surface medial condyle of the tibia class, right? Let me draw something about this structure class. Please listen carefully, class. All right. Okay, let's expose that this is anterior view. Anterior view, your knee joint, right? So this is your condyle of the femur, right? Bilateral condyle of femur, which is medial and lateral condyle. And centrally, you have your patella over here. And below, absolutely, this is condyle of the tibia, all right? Condyle of the tibia. And laterally, you have fibula, right? Okay. So this is your tibial tuberosity of the anterior, right? You need to remember about this spot actually, right? This region, this is your lateral condyle, this is medial condyle, all right? Okay, okay. So this muscle actually insert dekat mana? Dekat bahagian this region actually, dekat this region, dia attach, dekat this region. Okay, meaning that they attach dekat mana? Dekat bahagian inferior to the middle condyle. Understood? Inferior surface, medial condyle of the tibia. Inferior surface, medial condyle of the tibia. I think easy to understand, right? Okay, so you can imagine just di bawah middle condyle. It's not exactly to middle condyle. But when we talk about the middle condyle, posteriorly, absolutely, itu adalah attachment site untuk semimembranosus. But when we talk about anterior view, okay, which is inferior surface middle condyle of the tibia, this spot actually it become incision for several muscle actually. The first muscle yang saya dah explain tadi dekat you all class, right? The first muscle basically attached into this region, and this muscle kita panggil sebagai, yes class, sartorius. Understood? Sartorius. Right. The second muscle, which is attached into your inferior surface middle condyle of the tibia, and this muscle will be your yes class, tendinosus. Yes, semitendinosus. The third muscle that we will describe after this in adductor group, the third muscle in adductor group, right? Third muscle, which is attached into the same spot, attached into the inferior surface middle condyle of the tibia, and this muscle known as gracilis. Okay, gracilis, right? So three muscle cross your knee joint medially and attach into the inferior surface medial condyle of the tibia class. Understood class? So please remember, when you remember about the incisions of the semitendinosus, you must remember about incisions of the gracilis and also incision for the sartorius. It share similar incision. Because why? Because of these three tendons, basically, right, before insert into this area, inferior surface medial condyle of the tibia, right? So what you can see here, class, for example, ini adalah tendon sartorius, ini adalah tendon semitendinosus, dan ini adalah tendon gracilis. Basically, this tendon akan join together, class, akan join together dan attach pada mana? Attach pada bahagian this region. Which is this region, you refer kepada apa class? You refer kepada inferior surface middle condyle of the tibia. Because this tendon, ketiga-tiga tendon ini dia blend together. Dia tendon ni seolah macam fuse together, dia bercantum. Right? Before insert into your tibia, all these tendons, it seems like they share common tendon, common incision. It share common incision class, right? That's why these tendon collectively, these three tendon, before insert into the inferior surface middle condyle of the tibia, these tendon collectively kita panggil sebagai, please remember this terminology, we call it as a pes anserinus. Pes anserinus. What is pes anserinus actually? Pes anserinus basically refer to the conjoint tendon. Please again, another word for you, class, right? Conjoint tendon, which is this tendon joined together. We refer as a conjoint tendon. Which tendon, class? Conjoint tendon for number one, semitendinosus, number two, sartorius, number three, your gracilis, right? So pes anserinus refer to the conjoint tendon for the semitendinosus, for the sartorius, and also gracilis, and insert into the same area, which is insert into the inferior surface medial condyle of the tibia on the anterior side, on the anterior side class, right? So, so do you have any questions of our class? Clear class? No? Clear class? Clear class? Clear?
Okay.
All right.
Sure.
All right. Now, back to this atlas. All right. So this is referred to the inferior surface medial condyle of tibia, anterior view, right? If I rotate this knee joint medially, now clearly you can see this tendon actually class. See? Can you see this tendon class? One, two, three tendon. See? This is sartorius, this is gracilis, and this is your semitendinosus. See? These three tendons, even though coming from the different origin, right? Coming from different origin, but somehow incision, everything insert into the same area. Alright, dekat mana? Inferior surface middle condyle of the tibia. That's why these three tendon, conjoint tendon for these three muscle collectively kita panggil sebagai pes anserinus. Right? We call it as a pes anserinus. Right. So now, so complete your hamstring muscle in class. Complete your hamstring muscle. Right. Your bicep femoris attached into head of fibula. Your semitendinosus attached into your inferior surface medial condyle of the tibia. And the last one, your semimembranosus attached into posterior surface medial condyle of the tibia. Posterior surface medial condyle of the tibia. Soalan second class. Anything? Class? Anything?
Sir,
Yes.
I thought the semitendinous attached to the inferior surface of the medial condyle.
Semitendinosus.
Oh,
Yeah, correct. Yeah, correct. Yes, this one. Correct.
just now when you mentioned the posterior
Posterior
surface.
surface is semimembranosus.
Oh, okay, okay.
Semimembranosus. Don't confuse with these two muscles actually, right? Okay. Semimembranosus attached into the middle condyle but posterior surface. Okay, that's what I mentioned earlier, right? Semimembranosus and also bicep femoris attached at the posterior surface of the knee joint. One attached posterior surface of the fibula, head of fibula. Number two, posterior surface of the middle condyle of the tibia. This is by semimembranosus, except semitendinosus attached anterior surface actually, which is attached into inferior surface middle condyle of the tibia. Clear? Right.
All right.
Okay, very good. Right now, now I think in terms of insertion is very, very clear. You understood, class, right? Okay, now listen carefully, class. Listen carefully, right? You should remember about the movements. Number one, your hamstring muscles, basically, your hamstring muscles, right? Over here, you can imagine, class. This is your, let's expose that this is your acetabulum. Sorry. This is your acetabulum, class, right? This is your head or femur, same thing, right? Always draw the same diagram, class. Okay, many, many times, right? right? This is condyle of the femur, and then this is your fibula, right? Okay, this is your tibia and fibula, right? Right. Now listen carefully, class. And absolutely from this region, you can see your. You need to remember that just okay. Below you have all right over here. Absolutely, this is your greater. This is your ischial tuberosity, right? This is simple diagram. Ischial tuberosity over here, class, right? Okay. Now listen carefully, class. Your hamstring. So I think I should draw a better diagram actually because this is almost anterior view actually, class. This is almost anterior view. Okay. Okay. Now, okay, I draw superior view, posterior view. This is your ASIS. This is AIIS, right? ASIS, AIIS. Okay. So this is your sacrum, right? Sacrum. Okay. All right. Okay. This is your symphysis pubis, right? All right, and absolutely, this is your head of femur, right? Greater trochanter, lesser trochanter. All right. Okay. This is your head of fibula. Okay, now listen carefully. So this is your tuberosity. Clearly, this is the posterior view. All right. Now, first muscle that you should know is this muscle coming from ischial tuberosity, plus, and also another muscle coming from where? Coming from linea aspera, and this muscle attached into your yes class attached into head of fibula laterally. So this line indicate this is your yes class. Which muscle class over here? Yes, this muscle known as a yes.
Semitendinous.
Coming from ischial tuberosity and also linea aspera attached into head of fibula posteriorly. This muscle known as a
Bicep femoris.
yes, passive femoris, right? Which is you have long head and you have short head. Am I right? That's number one. Am I right, class? Number two, you have muscles which is extend from ischial tuberosity, and this muscle straight away attach into your posterior surface medial condyle of the tibia, class. This muscle known as a yes class. This muscle known as a straight semi. Very good. Semi-membranosus, right? And the last one, okay, the most superior part over here, right? This muscle is in term of shape, the almost a tendonous in term of shape, right? Very thick muscle plus from posterior. Now these muscles become anterior. They can pergi ke bahagian anterior. Okay, they can become anterior, right? So this muscle we call as a semi-tendinosus. Okay, semi-tendinosus. Now listen carefully, class. When we talk about hip extension, when we talk about hip extensions, only these three fibers are responsible for hip extension, class. Because of these three fibers, basically cross your hip joint posteriorly. Even though this muscle adalah synergis muscle, tetapi and yet dia assist your gluteus maximus. It cross your hip joint posteriorly. Only these three fiber. You will you boleh labelkan kelas? You boleh listkan apakah three muscle tersebut? Three fiber of hamstring cross your hip joint posteriorly where this muscle assists in term of hip extensions. This muscle will be your yes class. The first one ini adalah you punya
Bicep femoris.
specific. Specific. Which head actually? Head apa?
Long head.
Yeah, long head actually. That's why I explained many times, right? So I explained ada short head, ada long head. Meaning that only long head yang cross your hip joint, understood? So meaning that in term of hip extension class, right? Kalau saya kata dengan you sekarang ni, my statement was, okay, saya berkata dekat you, short head of bicep femoris, right? act as a hip extension movement. Sorry, hip extension muscles. But short head of bicep femoris act as a hip extension muscles. You should know whether true or false. Am I right? Betul kelas? The answer is true or false. Short head of bicep act as a hip extensor muscles. True or false? Short head of bicep femoris. Short head of bicep femoris. This is your short head actually, right? How come short head? This is your short head, am I right? In order to move your hip joint, this tendon must passing through your hip joint, but somehow this joint below, am I right? Okay. It doesn't it doesn't pass through your joint actually, your hip joint. Only long head yang pass through, am I right, class? Meaning that in terms of hip extensor, only three muscles. The first one, you are the hip, you are the long head of bicep femoris. Number two, you are the semitendinosus. Number three, you are the semimembranosus. Understood, class? Second, all this fiber, every fiber, long head, short head of bicep femoris, semitendinosus, semimembranosus, everything cross your knee joint posteriorly. Meaning that this is the role of your hamstring actually. Your hamstring, this hamstring, basically, the first one, dia hanya bertindak sebagai assistant muscle sahaja for movement apa? Hip extension. Understood? But this muscle, kalau saya tanya dekat you sekarang ni kelas, this muscle cross how many joint? They cross? Your hamstring cross how many joints actually? Yes. This hamstring fiber cross how many joint? How many joint that this muscle passing through before insert into your tibia and fibula? Yes.
Two,
Pardon?
one,
Are you sure one?
two.
It's look like you tak faham lagi actually, right? This muscle cross two joint, am I right, class? The first one, they cross apa? Your hip joint, am I right? The second one, they cross apa, class? Your knee joint. Yes. Meaning that your hamstring ada two joints yang dia boleh gerakkan. Understood? That's why this hamstring kita panggil sebagai biarticular muscles. Understood? Biarticular muscle. Meaning that this muscle cross two joint. Bi means two, right? This muscle cross two joint. Number one, they cross hip joint. Number two, they cross your knee joint. But the thing is sekarang you should understand adalah dekat mana joint yang sangat penting untuk digerakkan oleh hamstrings you all. Hip joints, these hamstrings basically are not very effective untuk gerakkan your hip joints actually. Right. Because that's why your hamstring dekat your hip joint hanya bertindak sebagai assistance only. It become your synergist muscle for hip extensions only because the prime mover for hip extensions will be your gluteus maximus. Yeah, your gluteus maximus. But the real movement for the hamstring basically, yeah, in this joint actually, which is this is your knee joint. This is your knee joint actually, class, right? So this hamstring basically is most powerful, very very important muscle basically, yang mana this muscle adalah penting untuk melakukan this pergerakan. Pergerakan apa, kelas? Again, saya tak nak you hafal actually, kelas. You boleh ingat dan you boleh faham. This is your femur, this is lateral view, this is your tibia, class. Okay, so this is anterior, this is posterior, class. Am I right, class? That you can imagine, class, this muscle basically sitting posterior. This muscle basically sitting posterior to your femur. Am I right, class? That's what we call it as a posterior compound muscle. And this muscle basically attach most dekat bahagian mana? Most of this fiber attach dekat bahagian posterior your tibia ataupun your fibula class. Right. Now, if I'm asking you class, if this muscle contract, this tibia akan moving posterior ataupun akan moving anterior? This tibia. If hamstring contract, what happen to your tibia and fibula? Dia akan bend towards posteriorly atau bends anteriorly? Which movement?
Posterior.
Posterior. If this tibia bend posteriorly, macam ni, right? Dia bend posteriorly. Okay, dia bend macam ni, right? Posteriorly, right? This is your patella, right? This is your patella. Ini, dia bend posteriorly, right? Dia bend posteriorly. Apa nama movement ni? Apa nama movement ni, class? Ini, this one. Apa nama movement ni actually? This one. Your tibia move posteriorly. Decrease an angle, right? Flexions. Very good. Meaning that this is the role of the hamstring. Hamstring is very, very powerful in terms of knee flexions. Understood? Knee flexions. When you try to bend your knee, when you try to bend your leg, actually, right, this is the actual role for your hamstring. Okay, that's what we call as this hamstring basically become your knee flexor muscle, the major for the muscle which is involved in knee flexion. Okay, hip extensions only assistant muscles, but for knee flexion ini merupakan prime mover muscle there actually, right? So please remember, hamstring muscle, even though this muscle basically biarticular muscles, dekat hip joint it become assistance muscles only, not so important actually, right? They assist in terms of hip extensions, but for the knee flexion, this hamstring akan become dominant muscles, prime mover muscles, main muscle, chief muscle, which is untuk lakukan pergerakan apa? Pergerakan knee flexion class, right? Hope you understand class. Okay? Soalan second class, clear? Clear class so far? And I think finish regarding your hip extensor. Okay, regarding the hip extensor. Okay, so we can sum up about this hip extensor. For the chief hip extensor, primary chief hip extensor, Gluteus Maximus. For synergist hip extensor, we have hamstring, but the real function for the hamstring basically for the knee flexions. All right. So these are the things that you should know about your posterior muscle actually, right? Okay, your gluteus maximus and also your hamstring fiber. Right. So far, any questions so far, class? Clear, class? Clear, class? Anything?
Clear, sir.
Okay. Now we already covered flexor muscles, extensor muscles, and also abductor muscle. Am I right, class? Okay. Okay. Okay, I think we stop for a while. I give you 5-minute break. After this, we go to the next group for the hip joint muscle class. Okay? All right, 5-minute break, class.